There are many types of hernia where a small part of your bowel finds its way through your abdominal wall. So in this video, we'll look at what exercise precautions you should take if you have a hernia or if you've had a surgical repair for one. Hi everyone and welcome to Exercise for Health. I'm Richard and today I'm going to provide exercise advice for people with a hernia and for those who are recovering from surgery for a hernia repair. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Hernias are more prevalent in men, affecting 27% in their lifetime, whereas only 3% of women are affected. The most common type is the inguinal hernia, which accounts for 75% of all abdominal wall hernias. This is where part of the intestine can protrude through a weak part of the abdominal wall, causing a lump under the skin in the lower part of the abdomen. Men are more susceptible because the inguinal canal, a hole for the spermatic cord, is already a significant weakness in the abdominal wall and can therefore become bigger through excessive pressure by coughing, sneezing or straining too much, allowing for the intestine to push through. In most cases, it won't cause any trouble, but it may feel a little uncomfortable, it could get worse over time, and it's not likely to heal itself. In a small number of cases, the hernia can become strangulated, which means that the blood supply to the intestine has become restricted, and this would lead to emergency surgery. Depending on how the hernia affects you and your age will depend on the course of action you take, as some people may opt for a surgical repair where a mesh is placed on the inside of the abdominal wall, covering the hole to stop the intestine moving through it. But some won't need to do anything at all other than be mindful of it and monitor it for changes. There are other types of hernias that have the same symptoms, and they include an umbilical hernia, a femoral hernia, an incisional hernia as a result of surgery, an epigastric hernia, a Spigelian hernia, as well as other less common types including diaphragmatic and muscle hernias. One other common type that I've discussed on another video is the hiatus hernia in the stomach. So if you need advice on this one that causes acid reflux, then check out my video on that up here, and I'll also leave a link in the description below. So if you have a hernia, but it's not causing any problems, then the general advice is to continue your day-to-day activities as normal, but pay particular attention for any changes. The older you are, the weaker your abdominal wall is likely to be, so you may have to be a little bit more conservative with what you choose to do if you're in your 60s, 70s or 80s. There is a risk of making it worse if you are lifting very heavy weights, forcing a great deal of intra-abdominal pressure through bracing before and during a lift, but this is not to say that this will happen, and you're just as likely to make it worse when you cough or hold in a sneeze. So unless you're an extreme weightlifter, most types of weights exercises are going to be okay. But if you are lifting heavier weights or doing high impact sports where the risk of further rupture is increased, then it's definitely worth investing in a hernia belt to protect it while training. Some people that are regular gym goers have experienced a tearing feeling in the lower abdomen when performing a single arm row with a hand and knee on a bench. This could be due to the position of the leg with the foot on the ground and the additional stress placed on the lower abdominal muscles to support the movement. Therefore, if you have a hernia, it might be worth exploring other alternatives to this particular exercise. Any exercise that places the abdomen in a stretched position, this is hyperextension of the lumbar spine and a forward tilt of the pelvis, such as some yoga poses, whether statically or dynamically isn't recommended, as it will place additional stress on the hole, potentially making it worse. However, at the same time, it is good to try and strengthen the muscles around the lower abdomen. Transverse abdominis is a corset-like muscle that works to stabilize the spine and pull the abdomen in. So doing an exercise like button pulls, where you are led on your back with your knees bent, and after breathing in, you slowly breathe out while sucking your belly button in back towards your spine. You can even contract the pelvic floor muscles at the same time by thinking about holding in your urine. After holding for a few seconds, relax, then repeat again 4 or 5 times. If while exercising you feel that part of the intestine has protruded through the hole and it feels uncomfortable, then the best thing to do is lie down on your back and let gravity do its job to allow it to return back in. Sometimes it may not do it itself, but if you've been shown how to do it, you can gently use your fingers to help feed it back in. If you have had surgery to repair your hernia, this will have been either laparoscopic surgery or open surgery, then depending on which type and how long ago it was, will dictate what you'll be able to do and when. The medical advice is that for laparoscopic surgery, that's less invasive, you'll be able to return to a regular routine of daily activities around the home after 3 days, be able to walk outside after 1 week, go back to steady jogging, other cardio or aerobic exercise after 6 weeks, and then return to full exercising, including strength training with weights, taking part in sports and other more strenuous activities after 12 weeks or 3 months. For open surgery that may take longer to recover from, these stages may vary depending on the rate at which you recover, and it may be that you need to be a little bit more careful or conservative with your increases in physical activity. It is advised, however, that for this group, after 3 months, you should start abdominal exercises to begin to strengthen up the weak muscles that are affected by this type of surgery. But you may need to wait up to 6 months after the surgery before resuming more strenuous lifting exercises. Being mindful about how you feel that you are healing and keeping in contact with your surgeon will also help you recover psychologically to get your confidence back. So if you're ever unsure, better to be cautious and check first. After 3 months, gentle exercises for the core such as pelvic tilts, lying on your back, pulling your tummy in and lifting the tailbone of the spine up, pressing the lumbar spine down into the floor. Knees to side, controlling spinal rotation from left to right, working through a comfortable range of movement. And the button pulls explained earlier in this video will all help to gradually build the strength of those abdominal muscles that have been weakened by the surgery. Providing you allow time for the tissue internally to repair fully and there are no complications during your surgery, you should expect good future prospects and return to normal activities and exercises that you did before your hernia. As a precaution though, I have spoken to many clients in the past that have said that they ended up with a second hernia in a different area of the abdomen. So if you have had a hernia previously, you may be more prone for another one in the future. Therefore, listen to your body, maintain good technique with any exercises, breathing correctly while performing the movement, and maintaining strength of the core muscles are all crucial to reduce the risk for any further problems. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.